So my name is Dr. Caryle Jensen, and I work in the Uxbridge community. We're a small hospital and local community that services a wider area as well. So in our town, there's about 14,000 people, and then we service about 20 or 30,000 outside of the community. We work with 10 other doctors at the hospital, and that includes a pediatrician as well, which is really nice for little hallway consults when you're not sure what's going on with a little kiddo. I also work at the hospital. I'm actually the chief at the hospital there, and so I do hospital-based medicine. I do emerge work. I do palliative care as well in the community, so there's house visits that are sometimes involved. I don't do obstetrics. In fact, we don't do obstetrics in this community because there's no OB backup and we don't have any anesthesia backup, so it's not a possibility. But I do follow my patients through the first and second trimester of their pregnancy, and then I punt them off to the obstetrician gynecologist, sometimes to the midwife. If someone's really interested in doing obstetrical work, we actually have a fantastic midwife group, and absolutely electives are available with them, or a day or two with that group if that's desired. In terms of what a usual week looks like for me, about a day or two before I know what I'm doing, because there's so many different things we do. So I might be doing a house visit, I might be going to the local retirement home, we might have an emerge shift, we might have walk-in, and we might have hospice. Now when I'm on the hospital ward, I do that for a week at a time because otherwise the continuity of care is no good. Otherwise, all the other clinical responsibilities are a mix. So we might start the morning in the clinic, over lunch hour go to the local retirement home and see someone, see some more patients in the clinic, and then do a palliative care home visit at the end of the day. However, I don't work ridiculous hours, so typically it's a 9 till 4 that are in the clinic, and then the emerge shifts are 8-hour shifts, so they're from 8 to 4, 4 to midnight, or midnight to 8 a.m. If you end up coming to our community and living in our community, because some residents will travel to and from, then there are some accommodations in town, and everything is really a 5-minute walk or drive away, and you can certainly walk in this community to get to the hospital and to the clinic. And certainly if you're joining me, you can just come in my car if we have a house visit and things like that. I won't make you walk. It's a very vibrant community, so a lot of people think of Uxbridge as this small little sleepy town with mostly geriatric population, but our average age is actually 42, so there's lots of young families. And we are the trail capital of Ontario, so if you haven't heard that, it's a small little town, but we have lots of trails. So if you like to run or mountain bike, there's lots of trails around here where you can do that. And if you like to road bike, the road cycling around here is fantastic as well. I wouldn't recommend it in the winter, but other times of year it's great. Speaking of the winter, you don't need to bring your snowshoes. We do get snow, but we don't get like ridiculous amounts of snow. So you'll get around fine here in the winter as well, and there's lots of ski hills around here. So if you like to downhill ski, there are 3 ski hills, and they actually keep our emerge nice and busy. You'll get lots of exciting work from our ski hills. And there's cross-country ski trails as well, so those are lots of fun. In the town, in terms of amenities, there's several gyms, and you can get a month-long membership while you're here. There's grocery stores, there's eateries. In terms of eateries, we don't have all the ethnic, fabulous options that you have in the city, but we do have Mexican, Thai, and Chinese, and we have sushi just recent, and it's good. So in terms of what will be done in the clinic here, our EMR is Practice Solutions, and if you haven't worked with that particular EMR before, it's very, very simple. It's a quite intuitive process, and we have a little cheat sheet that we can provide you. I see the full gamut from young babies to very old and everything in between. Procedural-wise, I really enjoy doing procedures, so there's usually lumps and bumps, incisional biopsies, punch biopsies, IUD insertions, endometrial biopsying, toenail removal for ingrown nails, and a specific procedure called the Van de Vos procedure, which is a bit more involved. And I get referrals from local communities to do this surgical procedure. Otherwise, our immunizations are done by our nursing staff, so we don't do a lot of our own shots, but if that was an interest, of course, we teach you how to do that. If when you're coming to work with me as a resident, and you would actually because you're here for 8 weeks, we will have 1 week of hospitalist work while you're here. So the sorts of things you'll see on the ward, small bowel obstructions, pneumonia, COPD, CHF, angina, cardiac issues. There's always, of course, the frail older person that's kind of failing to cope. We do have, every community has those as well. We work with an interdisciplinary team, so there's occupational therapy, there's physiotherapy, there's social work, there's home care. We have nursing colleagues as well. So you'll get to work with that entire group in helping these patients get back to their home environment. In the emergency department, when you work a shift with me, it's single coverage. So it's me and you, and that's it. There's no RT, there's no gen surg, there's no anesthesia. So when something critical comes in, we get to deal with it. So hopefully that excites you, because it excites me to do those sorts of things. So if there's an intubation, you will get to do the intubation. If there's a chest tube to be placed, you get to place the chest tube. So it can be very exciting. We see about 20 patients per shift on a day shift. Overnight it's much less, 4 or 5, and it's highly dependent. There's some days where it's very quiet, so we can do some teaching, but there's some days where it's very, very busy, and we might be a little bit run off our feet, but it's always very exciting. If you decide to come to work with me here in Uxbridge, I'm sure we'll have a fantastic time. And if you're good, I'll do my best to recruit you.